The Hamilton Center for Child Advocacy is a safe, child-focused place where children and families come when there's a concern about abuse or neglect. Our goal is simple: to make sure that kids who've experienced trauma feel protected, heard, supported every step of the way. But we don't do this alone. What makes the CAC unique is that we bring together professionals from different agencies: law enforcement, child protective services, medical, mental health providers, all of us under one roof. Instead of a child being interviewed over and over by different adults in different locations, we streamline the process. The child tells their story once to a trained forensic interviewer in a safe and supportive environment. And from there, the team works together to investigate, treat, and advocate for that child and their family.
An advocate provides crisis intervention and fosters resilience from the moment that a child and their family comes to our center. Through a holistic approach, advocates offer referrals, education, therapeutic support, and case management services. We also collaborate really closely with our multidisciplinary team to support the family through prevention, intervention, investigation, and prosecution of child abuse cases. Our goal is to make sure that a child is never alone and is believed. We also work with the family throughout their healing journey until the end and sometimes after.
The role of the nurse at the center is to provide medical exams and STI testing to children whose disclosures might warrant that. When a child has an exam here, it's purely their choice, and we make sure that they know that they're in control. The purpose of the medical exam is just, I tell them to make sure that their body is okay, and if there is an injury, who else might they need to see? What do we need to do to make sure that injury heals and they won't have any pain or issues going forward? And then we can do testing, and if there is anything that's found in the testing, we can do treatment for that. Once they see me, then they'll work through their trauma with the therapist.
As a forensic interviewer, once the advocate has explained the process to the child, we'll come greet them in the family room, and what that looks like is I'll let them know what's going to happen that day, that I'm going to get to talk to them, and then they'll go back to my room, and we conduct neutral, non-biased, child-led interviews. We're trained in Child First protocol, so what that looks like is we will build rapport with the child, and then we'll move into narrative practice. And for narrative practice, I want to know how they're going to disclose. I might ask them what they did today or about a specific event that they've experienced. And then afterwards, we'll go into topic of disclosure. So what that looks like is they might start disclosing about what's happened to them. And then afterwards, we return them into a neutral space. So I might ask them, what their plans are once they go home, or since it's summertime, I might ask them if they've done anything exciting for the summertime, because we just talked about something pretty rough. And so I want to make sure that they are back down to a more calm, neutral space once they leave the interview room.
Each year, our Child Advocacy Center serves hundreds of children from across the community. And just last month alone, we provided support to 89 children. The majority of the cases we see involve either sexual or physical abuse. These are incredibly traumatic experiences, and that's why having a Child Advocacy Center is so important. What truly makes our center special isn't just the services we offer, it's our people. Every member of our team is professionally trained in their specialized role, but beyond their experience, they bring something even more important: a deep and unwavering passion for helping children. That passion is what drives everything we do, and it's why our work makes a lasting difference.
Child abuse happens every single day in our community. A lot of the times I get asked how I do the work that I do, and my answer is always, it's the children. They're a lot braver, a lot more resilient than we think, and they don't get enough credit for that.
I might be the first person that they're disclosing these horrific details about, and I'm a complete stranger. So I want to make sure that these kids are provided a safe space where they can feel comfortable enough to disclose something that's happened to them. And what a lot of people don't realize is how hard that is for some of these children, and the weight that's lifted off of their shoulders once they come in there and they tell me everything that's happened. A lot of the time these kids have said, I feel a weight lifted off my shoulder. I feel so much better after I talk to you. And so that's probably one of the best parts of the job, is being able to be that for that child.
That one interaction with the patient is so special, because you're seeing them in this very vulnerable moment, and you're really getting to make a difference in their life at that time.
I see every day how vital a Child Advocacy Center is to the health and safety of our community. When a child is hurting, it doesn't just affect the one child or their family. It touches neighborhoods, it touches schools, it touches churches, and even the workplaces where the caregivers are. By responding to child abuse in a coordinated, compassionate, trauma-informed way, we're not only helping that child heal, but we're also strengthening the entire support system around them. Our center brings clarity to chaos. We offer a path forward when families are feeling overwhelmed with the process and unsure of what comes next. We connect the families and the children to critical resources to help them heal and move forward in their lives in a positive way. The ripple effect of that kind of care, showing up for children in their most vulnerable moments, can be felt throughout the entire community. And that's something that we should all be proud of, and I am very proud of to be a part of something that is so powerful and meaningful in our community.